So today's topic is body fat and dietary fat. It's on page number 164 in your sports nutrition textbook, page number 164, chapter 8. Those who will be joining late, please help them out with the page numbers and all. The dietary fat part of this particular chapter, we will discuss it in details when we will start our lipids chapter in nutrition science. Okay, so you will get the concepts are very same. It's the same thing. It will be repeated. Okay, so the sports part of it, the body fat part of the chapter, we'll discuss in detail here. The dietary aspects of lipids, trans fat, saturated, polyunsaturated fats, all that in detail we are discussing in our nutrition science chapter of lipids. So in that you will get in-depth knowledge on that. Okay. Those who are joining late, help them out with the page numbers and topic name, whatever we are discussing at that point of time. So body composition or body fat also, it's when we talk about body composition, it's about your entire muscle, okay, fat and non-fat part of the body, like organs, okay, water level, your hydration level of your body, all these things we are considering when we are talking about body composition. Okay, body fat has its impact on performance as well, because certain sports, if you have noticed, they are specifically under some weight category. Can you name few sports in which the competitors, okay, competitors are chosen on based on their weight? They can only compete with each other on the basis of their weight. Yeah, wrestling is one such thing. Most of the contact sport like wrestling, boxing, karate, okay, weightlifting, okay. So yeah, about the body fat, your body weight, and how it is going to impact your performance, how it is going to impact your competition. Okay, it matters. So we certain sports, this is a very main category, very much important main category. Okay, what is your weight in terms of your body lean mass proposition and your fat proposition? Okay, so relative body fat, a high relative body fat is generally detrimental to performance. For example, if you are a sprinter, racer, runner, or something like that, okay, you like long jump, etc. Okay, in which your body weight will have a direct impact on your performance. The heavier you are, the difficult it will become for you to run, okay, or carry your weight and perform the sport. On such cases, you have to be very careful about your weight gain. The other compartment are gymnastics, okay. Then we have the synchronized swimming and all, okay, in which body shape, not just the weight, but the body shape matters as well. So even in such sports category, your body fat levels are very much in control. It should be under control. Okay, so maintaining a low body fat is desirable in sports, but not like you should be on a very low fat diet as such. There is no such rule. Okay, it comes to what kind of competition you are facing, as well as your season, the season of the year. Is it a competitive season or is it off season? Okay, so your weight can fluctuate accordingly. So increase in fat might benefit in following of the sports, that is your heavyweight lifters, javelin throwers, okay, in which as well as sumo wrestlers as well, okay, and in swimmers also, fat gives you like it gives you the light. Well, it makes you lighter. Okay, if you are having too much of like when we will discuss about measurements of body mass, you will see this. If you have too much of lean muscle mass or your body weight composition, most of it is because of your muscle weight. Underwater you will weigh more. Okay, your weight will be much more as compared to a person who has the same weight in gravity, but a person who has more fat than muscles, they will weigh very less in water. Okay, so for swimmers, having a good body fat composition, it's ideal. It makes them lighter so they can move in the water very pretty easily. okay, as compared to swimmers who have a lot of muscle weight. Okay. So, but is fat an advantage in certain sports? Yes, definitely in certain sports, but also we have to consider that fat does not have the power, muscle has the power. Okay. So a heavy body can definitely generate more momentum. For example, javelin throw, disc throw. Okay, in such sports, the heaviness of a person's body will give you that momentum to throw it as far as possible. But the muscles which you use, okay, the hand muscles, etc., triceps, what you use to make that, to make to achieve that particular goal, okay, to achieve that particular distance, it comes naturally from your muscles. Your muscles have the power, your muscles have the strength and endurance to make you throw that long. Okay, but the only thing is that to achieve that particular heavy body, fat is essential. You can't attain that weight, okay, that expected weight, just based on your muscle mass. So in that case, to achieve that particular weight to give you momentum, you require fat. But to make a throw that is such a long distance throw, you require the power and strength of your muscles. Okay, so it is not completely because of fat that will help in these sports. Muscle power is important. So how can we like, how can you tell, are you too fat, too thin? What can you like? The best thing is to look at in the mirror. But again, if somebody who is suffering from a mental health disorders like anorexia, okay, how much of a thin they are when they look at themselves in the mirror, they tend to see that, okay, I am fat. Okay, they may be skinny, they may be very skeletal and skinny, but when they look at themselves in the mirror, they see a fat person. Okay, that is a complex body image issue. Okay, so for example, you can't rely on just by looking at yourselves in a mirror. Your perception may be like, okay, even if you are perfectly all right, you are lean, but when you look at yourself in the mirror, you may think, okay, I should reduce that bit much, I should reduce my thighs a little bit much, my tummy is a little bit protruded, I have to reduce that. Okay, and even if somebody who is bit overweight, but when they look at the mirror, they think, okay, I'm completely fine, I don't have to change anything. Okay, but whatever I look like, I'm happy with it. It's completely a very subjective perception. But to make things easier, to make sure that people know where they are headed to, okay, where they are headed to in future, okay, what kind of diseases are they at risk at because of their present fate, body mass index is a very good calculator. Okay, and even for a general population, if you are applying it to a group of people, body mass index again is a very good measurement for identifying what your good weight is, or do you have to reduce your weight or not. Okay, we have some disadvantages of body mass index as well, we'll see that. I guess all of you know how to calculate the body mass formula, we have repeated so many times. Your weight in kilograms divided by height in meter square. Okay, that will be your body mass index. So different categories, whatever your answers are, you can put yourself in these different categories. A normal BMI is somewhere between 18.5. Sometimes in some sources they say it is 19. Okay, so don't take it to the face value of it. Okay, just be a bit subjective in this case. Okay, so anything more than 24.9, or sometimes 20, about 25 also. Okay, they consider it as overweight. About 30 or above is obese. Okay, more than 35 is extremely obese. If your BMI is less than 18.5 or less than 19, in some sources they say if it is less than 19, also you are considered as underweight. Okay, we are coming to that, how to measure your lean mass, etc. There is measurements, we are coming to that topic. So BMI advantage and disadvantage. Advantages, it is very quick calculation, anyone can do that. Okay, if you have a basic knowledge of multiplication and division, you can find your own BMI. And also nowadays online websites and softwares are available. Just search BMI calculator, n number of pages will come. Just put your weight and height in that particular columns, you will get your BMI. Okay, so yeah, it is a very quick method of understanding. It is not costly, it will not cost you anything. Okay, so it does not require much skills as well. Okay, you don't have to be a scientist, or you don't have to be a specific professional to do this calculation. Anyone can do it. Those who have the idea of it, knowledge of it, they can do it. Okay, procedure is very less invasive, you don't have to go anywhere. It is better accepted in most of the districts and all over India. Why? Because for a general population, to conclude something about a general population, BMI is a very good measure. So what are the disadvantages it has? Okay, it is not as accurate. It won't give you the accuracy of like how much okay, this is your BMI, but even though you are under the overweight category of BMI, you have a good muscle tone or not. That kind of information you won't get with BMI. Okay, it only provides information on the appropriate weight a person should have based on their gender and based on their height. Okay, appropriate weight based on their height. Okay, this is an average weight category in which you should come. If you are under this weight category, you are considered healthy. Other factors of health, like your mental well-being, your social well-being. Okay, even a person who may be suffering from cancer, okay, who may be suffering from final stage cancer, may still have a perfect BMI. Does not mean that they're healthy. Okay, so factors are not considered in BMI. So these are the disadvantages. So body fat distribution, before coming to the measurement, like most of you know, like which kind of body fat distribution are the most common one. Apple and pear. Apple is pretty much very common in males. Even some females have an apple sized body shape, and pear shape is also more common in females, but some men also do tend to have a pear shaped body. Okay, it's not black and white. Okay, there is a gray area in all these body shapes as well. Okay, so apple shape, when you have a lot of adipose tissues, visceral fat as well. Okay, it is deposited in your abdominal region, like what we call it as a beer belly. Okay, or pot belly. Okay, so that comes from an apple shaped body shape. Then in pear shape, hips, thighs and buttocks hold majority of your fat centers. Okay, that is pear shaped. And what is the health based repercussions of these shapes? People who have apple shaped body figure, okay, they are at higher risk of getting lifestyle diseases like diabetes, okay, CVD, stroke, certain cancers. Okay, and they have, because they already have this predisposition of such lifestyle diseases, automatically they come under the risk of early mortality. Okay, that's just because if they reduce their weight, they control their weight, they watch their weight, this risk can be erased. Okay, so this is the body fat distribution in general, just a snapshot of it. In women, why it is mostly pear-shaped body, because the fat which is there in their hips, thighs and buttocks, most of it will be used during their reproductive age, especially when they are pregnant, and even soon after lactation. That's the time when majority of this fat, which is already deposited in hips, thighs and abdomen, will be utilized for energy. Okay, so body composition, do you are like to understand how healthy you are, or do you have the risk of these lifestyle diseases which I have just mentioned in the previous slide? Okay, there are certain body fat distribution measurements. Okay, measurements in terms of you can't be it will not give you 100% guarantee or accuracy that you will suffer from this disease. It just puts you in the risk category. Please make sure of this particular statement. These measurements, the waist circumference, waist to hip ratio, waist to height ratio, okay, these measurements just gives you an idea of what your present risk is. Okay, what is the conclusion of your risk? Okay, if your waist circumference is high, waist to hip ratio is quite high and all, okay, what it means, you are at the risk of lifestyle diseases. Okay, it does not conclude these circumferences and these measurements will not conclude, or it will not diagnose certain diseases. Okay, it just puts an individual to a risk of certain diseases. Okay, so first is your waist circumference. For men and women both, it is different. Okay, for men and women it is both different. So for women, okay, if your waist circumference is somewhere like say somewhere around 94 centimeter, okay, and for men it is, if it is more than 80 centimeter or something, it means that you are at the risk. Okay, more than 94 centimeters in women, more than 80 centimeter in men. But these numbers what they have given in the textbook, if you see some various other online sources, or if you refer some other textbooks, there will be slight changes. So you can't go into this with a blind eye. Okay, then we have waist to hip ratio calculation. That gives you waist to hip ratio calculation gives you the numerator should be waist in centimeter or inch, whatever you can take. Okay, numerator should be waist, denominator should be hip. Okay, whatever is your waist size, hip size, put it into this in this calculation, the number what you get. Okay, if it is less than one or something like that, it is a pear shaped body. If it is more than one, it is a apple shaped body. Okay, then there is one more ratio, that is waist to height ratio, that is given in the textbook. Waist to height ratio, it's very simple. It is very what to say, it is very subjective. Okay, waist to height ratio is very subjective. How do you do the calculation? Take your height in centimeter. Okay, whatever your height is, if you know your height in centimeter, okay, keep that figure in mind. Okay, whatever is the height centimeter, divided by 2, divided by 2. Okay, whatever answer you get, your waist should be that or less than that. Whatever answer you get by dividing your height by 2, if it is more, if the answer is more than that particular number, if your waist is more than half of your weight, if your weight is more than half of your height, it means that you are overweight. For example, let's say, you can do this calculation, if you have a calculator with you, it will be really nice. Okay, so the height of a person, let's say it is 172 centimeter, as given in the textbook, 172 centimeter. What should be the ideal waist for them, for this person? Height is 172 centimeter. What should be the ideal waist size? The upper limit of the waist size which this person has to maintain. Yes, 86 centimeter. If you convert 86 into inches, you have a 34 inch. So 34, 32, okay, all these things, inches are better understood because we buy our jeans and trousers, our bottom wear, etc., based on the waist inches. Okay, so if a person is of certain height, divide their height into divided their height by 2. Okay, whatever the number remains, that should be the upper limit of their weight. Then the here their waist is 86 centimeter. Okay, even if it was 84, 80, they are still healthy. If their waist uh, goes beyond 86 centimeter, like 90 centimeter, 94 centimeter, something like that, it means the person is overweight. Okay, they are at the risk of getting cardiac disorders or lifestyle disorders. Okay, that's the height to waist ratio. So body composition, what it means. Okay, body composition means the entire components of a human body and their proportion. Okay, we all know human body is made up of this and this, but in percentage, when you put those items into percentage, that's when you get a body composition. Okay, so it reflects the relative amount of fat in your body, fat percent in your body, and the fat free mass in your body. Okay, what all are the fat free mass in your body apart from muscle? Can you name few in the chat box? Apart from muscle, fat free mass in your body apart from muscles. Yes, tissues, bones, tissues, water level, electrolyte levels. These are the fat free masses in your body. Okay, so usually we use body composition when it is related to fitness or some health or some sports related activity. Body composition comes into play. So this is how you measure body composition. There are 5 to 6. Okay, more than here we have shown only 5, but there are more than 5 variations of understanding your body composition. Okay, along with the margin of, they have mentioned the margin of error as well, because margin of error means the accuracy rate. Okay, how whatever result you get, what is the accuracy rate of it? Okay, so first and the foremost is your DEXA scan, dual energy X-ray absorptiometry. Okay, so that is DEXA scan. That's the full form of DEXA. It's given in your textbook on page number 170. Dual energy X-ray absorptiometry. So in DEXA scan, it was originally developed to understand your bone density, whatever a person's bone density is. Okay, the risk of getting osteoporosis, how soon, and those who are undergoing osteoporosis treatment and all, they also frequently take DEXA scan to see how their supplements are improving their health. Okay, so it was basically meant only for bone density, to identify your bone density. Okay, but later it's also put into use of understanding the fat to muscle ratio as well. Okay, so they use X-ray here, whatever the X-ray frequencies are, X-rays. Okay, not the gamma or infrared rays, only X-rays are used here to understand the entire composition. And it is, if you have seen the image of a DEXA scan, I guess when we will discuss about lipids chapter or some other chapter in nutrition science, you will I have provided the image of a of a post diagnosis image of a DEXA scan. Okay, how the scan looks like. So there are different colors for different parts of your body. Okay, usually the fat part, fat mass area is in bright colors like red, orange or yellow, and the hard masses of your body like bones etc are in blue color. Green is usually for muscles, and also the entire usage of these colors is calculated, and that gives you the exact composition of uh, different body components in percentage wise. Okay, the surface area used by these colors to cover the entire body. Okay, that is DEXA scan. Then we have underwater weight. It's very expensive, and only few institutions have the facility for it, because you require a swimming pool like of setup. Okay, and there are other heavy equipments also arranged to make sure that the person is completely submerged into the water. People who have this hydrophobia or claustrophobic and all, they can't do this. There are various disadvantages of using an underwater water weight. Okay, so the theory which we use here in underwater weight is, when you go underwater, obviously you are displacing, for the water to accommodate your body, it has to displace some amount of water, right? And when the water is displaced, there is certain amount of buoyancy. Okay, buoyancy, what we say, like when you dunk yourself into the water, some amount of force is felt on top of you. Okay, the because of this buoyancy, the water falls away, or when you jump into the swimming pool, you see water splashing into the outside areas. That is because of the nature of buoyancy. Okay, so what happens here is, when you are submerged into the water, okay, the water makes space for you, water accommodates you by displacing some of its component, and then the weight of the athlete is calculated underwater. If the athlete is on the heavier side, it means the athlete has a lot of muscle mass. If the athlete is on the lighter side, okay, when we do a comparison on the lighter side, it means the athlete has more of the fat composition in their body, because fat naturally tends to be lighter as compared to water. Okay, if you put some oil drops into water, you will see the oil will start to float on top of the water, because it is naturally it is lighter. So if the body of a person has a lot of fat in it, okay, the fat will make sure that they bounce up. Okay, so but lean muscle mass will make sure that the person has certain weight to them, and they feel the weight of the muscle mass under water. Okay, that is the underwater weight. They have a margin of error. It is just 96 or 97 percentage accurate. Okay, there is at least 3% of errors in underwater weighing. Then we have bod pod. Just like how we used water in underwater weighing, okay, we are using air in bod pod. Okay, the amount of air that is displaced by the body, the amount of air that is displaced by the body in this bod pod is considered, okay, to identify the muscle to fat composition. Okay, it has the same margin of error, 1 to 3%, so it's not that accurate. The most accurate one is your DEXA scan. Remember that the most accurate one is your DEXA scan. Then we have this BIA scale, okay, bioelectrical impedance analysis, BIA scale. Again, it has a huge margin of error. Okay, so you can't trust this as well. What happens here is you see this person holding on to some handles and standing on a machine. So this handle, through this handle and through the machine, slight electric currents are passed into the athlete's body. Okay, so what is the conclusion here is the muscle a high, but here remember this, a hydrated muscle, not the dehydrated. If a person is adequately hydrated, okay, their muscles will have enough water and electrolytes. Okay, and it's a science based question I'm asking you. What do you think is a better conductor of electricity? Is it fat or water and electrolytes? Which do you think is a better conductor of electricity? Fat in your body or water or electrolytes? It's water as well as electrolytes. They are the best conductor of electricity as compared to fat. So the ease with which the electricity is traveling in a person's body, that is considered as the conclusion for how well hydrated and how much of lean muscle mass they have. Okay, if the conduction is sluggish, if the conduction of electricity is very sluggish and slow, it means the person has more of fat cells in their body as compared to muscle cells. Okay, so that's the BI. Again, the margin of error is quite high. Then we have the skin fold test. In skin fold, you see this instrument, different parts of the person's body. Okay, if you have the textbook, with you, you can see on page number 171. Is it visible? A huge image of this particular skin fold uh, scale is used to pinch into a person's abdomen to see the amount of the length of the fold which they have got. Is it visible to all? A huge image. The entire page is only of that image. Okay, so that's how you use a skin fold test. Again, the margin of error is very high. You can see it is 8 to 11%. Okay, so different parts of your body, like your triceps, biceps, hip bone area, lower back, your abdomen, your tummy, okay, thighs, shoulder blade, all these areas are measured using this particular uh, measurement. And then all the numbers what you have got from all these different areas, they are added up. Okay, and some calculations is done. It is not given the textbook. Okay, but still the margin of error is so high, so it cannot be relied upon. You can't rely upon that. Okay, So some additions are there from all these different types parts of the body, whatever the measurement is, it's added upon and then something is concluded. Okay. So the most, remember this, the most ideal measurement of understanding your body fat composition, it's a DEXA scan. Okay. Then the types of fat you have in your body. Essential fat. Essential fat are the ones which your organs and the tissues require to make hormones, to make some biochemical reactions to take place in your body. Okay, it is also used by your organs for protection as well. So these are the essential fats. No matter what, how much of a weight loss you do, you should not risk yourself of depleting your essential fat. Okay, so essential fat is the bare minimum fat that is required for your normal body functioning. Okay, whatever fat loss you do, never try to compromise your essential fat requirement. Okay, for men, that of your entire body, for men from your entire body, 4 to 6% of the entire body should have essential fat. For women, those who are especially in the childbearing age, okay, from your menarche to your menopause, okay, that is a childbearing age. So 10 to 12% of a woman's body should have this essential fat. Otherwise, we will see what kind of disorders may arise for women if they do not have this, at least this percentage of fat. This table is given on page number 173, table 8.3, for different sports, for different sports, for men and women, what is the body average body fat percentage, fat composition average should be required, should is required for them to perform in these particular sports. They have to maintain this healthy fat level at any cost. Okay, it's the same table. Later you can just whenever you get some clients who are into this particular sport activities, you can guide them accordingly, only for that. Okay. So coming to the problems that are associated with very low levels of body fat. So this is a very rare case. It's not as common as how you see overweight issues and obesity issues, which is quite rampant. Okay, overweight and obesity issues are quite rampant. But the very low levels of body fat and all, it is very rare to find such cases. But still, nevertheless, it is very dangerous to the human survival as well. Okay, so for women, if you go less than 8 to 12% for the entire body percentage, you are at the risk. For men, 3 to 5% or 4 to 5%, you are at risk. And women, you get amenorrhea. Do you know what is amenorrhea? Those who know, you can just type in the chat box, amenorrhea. It's related to menstrual cycle. Anyone? Yeah, no menstrual cycle. There will be no periods. Okay, that is amenorrhea. It's not oligonuria. Oligonorrhea is different from amenorrhea. Oligomenorrhea is, which means you do get periods on a monthly basis or at least once in 2 months or something like that, but the amount of shedding is very less. Okay, less than 100 ml per cycle. Okay, that is oligomenorrhea. Okay, amenorrhea, there is no periods at all. There is no periods at all. There are no follicles in your body, in your ovaries, which are maturing. Okay, there is no estrogen. Okay, and because of these factors, there is loss of bone mass. The same thing that happens in your menopause period, that will be the same signs and symptoms will be seen here in this particular case as well. If you lose out on your menstrual cycle, it will definitely affect your bone mass. Okay, the relation between amenorrhea and bone mass, okay, we will discuss later in calcium chapter of nutrition science. So the following disorders will accompany with extreme leanness, especially for kids and women as well as men who are suffering from anorexia nervosa, etc. Reproductive issues will be there. They may have completely lost the ability to develop their follicles for child for maturing the ovum, etc. Respiratory issues, conjunctive or lung failure, etc. And circulatory issues, immune related issues, because see, to make immunoglobulins in your body, okay, immunoglobulins, antibodies in your body, you require fat. Okay, lipids are required to make these immunoglobulins as well as antibodies. If you do not have that enough amount of fat in your body, these things won't be produced. Okay, amenorrhea associated with women have that have very low percentage of fat, that is known, we have just discussed now. What leads to amenorrhea is your body's ability to produce estrogen. Okay, estrogen is required for the uterus lining to build up. Okay, the endometrium to build up every month. If you do not have estrogen, the endometrial lining won't build up. Okay, if the endometrial lining won't build up, there will not be any any implantation of the fertilized egg, or fertilized eggs will also not be produced, because you require estrogen along with follicle stimulating hormones. Okay, in the first part of your menstrual cycle, you require both these hormones, FSH, follicle stimulating hormone, and estrogen, follicle stimulating hormone, to make your follicles within your ovary mature to produce egg. Okay, and estrogen to make your uterine lining thicker. Okay, when these two hormones are not produced, neither the ovary will produce ovum, nor the uterus will produce this cushion bedding of endometrial lining to receive the fertilized egg. Okay, when there is no cushioning of the endometrial lining, there won't be any menses. That's how the pathophysiology functions here. Again, reduced estrogen will lead to reduced absorption of calcium into the bones. So more about the lipids, and after this, after page 175, it is more about your dietary lipid, fat in your diet, etc. In details, we will discuss about it in your nutrition science chapter on lipids. The same thing which is given in this textbook is repeated there as well. Any doubts, please mention in the